Hi, my name is Ming. I'm a senior biomedical engineering student at San Jose State University, and my project is the handheld metal detection method for verifying nasogastric tube placement. And this is the outline. I'm basically gonna go through all of these one by one and the topics of them. So, nasogastric intubation is a medical procedure where you place a nasogastric tube, or NG tube, down the nostrils of a patient, and it goes through the esophagus and ending up in the stomach. The purpose of this is to provide the patient with some sort of medication or nutrition, keeping the patient hydrated, and it could be used to extract content from the stomach, such as like blood or anything they need to be tested on. However, there's a problem with that, and that is it could end up in the trachea, which leads to the lungs. So as you can see on the image to your left, that's the correct placement. The stomach is actually lower a little bit than the entrance of the trachea. And the incorrect placement, which is on your right, shows that it ends up in the lungs, and you can see like there's like some sort of inflammatory there going on. So a quick anatomy lesson. From the nostrils to the entrance of the bronchus is around 28 centimeters, and the length from the nostrils to the entrance of the stomach is around 43 centimeters. So we can see like there's a difference, but the lungs, the bottom of the lungs is almost the same distance to the entrance of the stomach. And it's placed in the middle of your chest, so it's around 33 centimeters. And a normal adult male has a thickness from the chest to the trachea of around 14 centimeters. So the main problem with the x-rays is the long wait period it takes to get results, and this can be due to the availability, whether there is an x-ray available or not, and the confirmation from radiologists. Radiologists may need additional information, or it needs to compare previous x-rays, especially where the placement was wrong. And also the method how it delivers to the doctors. As you know, like phone and email is quicker than like fax and mailing. Some patients don't want radiations either, and 2/3 of the world doesn't have x-rays, so they required a different method to verify the location. So looking at different cases, we found out that in children, when they ingest like coins and stuff, we're able to find, or doctors are able to find the location with a handheld metal detector. So we're going to design our experiment based off of using a metal detector with a metallic tube. And there's already a metallic tube that exists. It's called a kangaroo NG tube. And we also found out that you can use handheld metal detectors to find pacemakers in cadavers. So they had to remove the pacemakers before they cremate or they bury them. And so our purpose is to design a method to verify the location of the tube without using the x-ray. There's no standard for verifying the location of the tube according to the FDA. According to the user need for a nasogastric tube, that you do need a verification, but it doesn't specifically state that you need to use the x-rays. The x-ray is just like the main protocols in most hospitals. And this project doesn't use the x-rays, but I put the x-ray on there anyway. And the x-ray has a lot of different regulations compared to like the nasogastric tube. And so the experiment is designed to measure in the x and y direction. So you're going to have a y direction of going up and down the chest, and left and right across the chest. So that's 2 locations and 2 different sweeps. Oh no, 2 locations as in the trachea and the esophagus. So the esophagus will have around 15 centimeters, and the trachea will be 14 centimeters. The difference between the 1 centimeter is the layer between them, separating them, but in actuality it's like around 3 millimeters. I only did 1 centimeter because I can't get the meat slab to be that thin. I'm going to be using the handheld metal detector and a magnetometer. The magnetometer basically operates the same as a handheld metal detector, but it provides some sort of value, the strength of a magnetic field. And it's going to go in 2 different speeds, comparing all that too. So a little bit more in depth, a conveyor belt is set up to have the meat slab move across at a constant speed. And at the end of the conveyor belt is a stand to measure the detection using handheld metal detector or the strength of the magnetic field using a magnetometer. As it moves across, it records. And after 1 experiment is done, the stand is elevated above 2 centimeters. And then the experiment starts again. There's going to be 3 trials for each position of the detector. And it's going to be done in 2 speeds as well. So looking at the results, comparing the x and y direction, the y direction makes sense where the trachea, since it's in front of the esophagus, has a higher detection time than the esophagus. However, in the x direction, going from left and right, the esophagus has a higher detection time, which doesn't really what we thought it would be, or what we don't want either. And comparing it in a higher speed, it has a lower detection time for in the x and y direction, but it seems like the esophagus is still like higher. So from that, I can conclude that the y direction is more optimal. And using the magnetometer, it seems like the trachea has a higher magnetic field strength, which also makes sense because it's in front of the esophagus. And for the magnetometer, it uses like a different frequency, like a lower frequency than the metal detector. So it does not detect anything above a 4 centimeter above the chest. So in conclusion, we're able to detect the tube with a metallic tip at the y direction, but we're unable to verify whether it's in the esophagus or the trachea. And so the x-ray is still optimal because it provides a visual. And so the 2 bar graphs shows the detection location of where the esophagus and the trachea, which is correct. And this is in the y direction, by the way. For the magnetometer, it's where the highest point is, which is also correct. And so for future works, I would like to have some sort of visual as it is being detected, whether or not it's in the esophagus or trachea. And also to obtain data from millimeters instead of centimeters, so we can see like more in-depth details. And also using a different material than titanium, because the metallic tube uses like titanium and it's not that sensitive to the detector. The cost analysis, so far there's over 1.2 million NG2 being placed each year, and 3 to 4% of those are misplaced. Each X-ray scan costs around $50 to $60 without health insurance, which is about 7 million each year. The cost for this project, the NG tube costs around $15 to $16, but they came in cases of 10, so we have to buy like from another source than the official website. The handheld metal detector is around $230, but we bought it at like different sites as well, like Amazon, for like a lot cheaper. The magnetometer costs around like $100, but depending on how strong you want it to be and how detailed, accurate, it can cost up to like $1,000. And I want to acknowledge Dr. Simon, especially for like the last months, for helping a lot, and especially for analyzing the data that I got. And I want to say thanks to the nurses and students that actually helped. It's my reference. Thank you. Questions? Comment? Concerns?
You were reporting for a while, you said detection time?
Right, so for the handheld metal detector, so I record the time when it first detects the metal, so when it starts making noise and vibrating, and then the end time when it stops.
Okay, and that was what was on the conveyor?
Yeah.
Okay, and then, so the idea is that as it's passing through, when it first hits it, it's going to detect it, and
right.
as it passes through, then it's just a go.
Yeah.
Did you know the rate of your conveyor belt?
Yeah, it's at 1 centimeters per second for one speed, and then the second one is 2 centimeters per second.
Okay.
So I'm just comparing like the two different speeds.
Okay, so in theory though, if you convert your speed into distance, you should be
right.
getting the same information, right?
Yeah.
Is that, did you do that? Are they consistent? Like at two different, does the speed matter in the end?
Oh yeah, it does matter.
Okay.
So I don't have the graph for that, but at a slower speed, it provides like a higher detection time than a faster speed.
Well, it makes sense though, right?
Yeah.
Because it's passing through the zone slower.
Right.
Right, but if you normalize it, if you got a distance out of it, what do you get? Isn't that what you want? You want to be able to measure the length of your tube or the distance of your tube?
Right. So with this data, like I did, so I calculate everything like the red bar is 2 centimeters per second. So I changed that into distance and calculated that it's around 43 centimeters for esophagus for
Okay.
Yeah.
Got it. Okay. And then just what's the spatial resolution of these two sensors? So like if you want to essentially detect is your tube there or not. The idea if part of it is you want to see is it gone away from where it's supposed to be. Is that the idea? Like the application of it in the end is you want to make sure that the tube's not gone into the lungs or not gone into the stomach.
Right.
So if I have my tube right here and I put my sensor right here, the magnetometer is going to detect the tube still.
Right.
It might not be as strong as a signal here, but it's going to be strong. How would you go about? You have to set a threshold, or how do you go about determining whether you're on top of the tube or just in the general region of the tube?
So with that, I wasn't really like I said, I wasn't able to properly confirm like the proper placement. Like it's just detected. Like I was able to detect at around 28 centimeters. I was able to detect it at 43 centimeters. But going in like the X and like the X direction, like where it's on top of each other, it's the values are more or less the same.
Okay, and how long is the tube again? Sorry, I missed. The size?
The size of the tube.
Yeah, the length, the metallic segment, how?
Oh, it's like 2 centimeters.
I don't understand why, like, how does the experiment relate to the goal?
So the goal was to provide like a method to make sure the tube is in the proper place without using the X-ray.
Right.
So I thought we could use like a metal detector with a metal tip on the tube. So if it's in the proper place, we can detect it. The problem is that there's no standard or whatever values to compare it to.
In terms of the deviation from where it's going.
Right.
So you took those measurements in the beginning of the adult person, so you'd say there'd be a range
Right.
of like distances from here to here,
Right.
where you should see your metal piece and where you shouldn't, is that?
Yeah.
Okay, thank you. Chandler?